This meeting is being recorded and/or transcribed.
Okay. We will now call the November 13th Board of Health to order. Before we get started, just a quick round of all those in attendance. For those on the line, if you could just state your name.
Sal Migliori.
Scott Fadness.
Vishal Parikh.
Karen Collins.
Kyle Holtgren.
Thanks, everyone. And then we have Monica Heltz and Dr. Indy Lane here from the Health Department, as well as Chris Greisel, our City Attorney. Quite a bit has transpired since Tuesday's meeting, and so today, just as we did when we talked to a number of businesses yesterday and restaurants to explain where we've come and where we're going, just a kind of a chronology, if you will. Last week, we started seeing the data, and Monica and Dr. Lane advised us that we needed to take some proactive measures. We worked on those through the weekend. Dr. Lane and Monica presented those at Tuesday night's meeting. On Wednesday, the governor came out with an executive order, or actually the intent to have an executive order around a number of restrictions here in the state of Indiana. There were no guidelines or restrictions prior to Wednesday, so Tuesday was our first best chance to really try to put some corrective measures in place. Wednesday, the governor came out with the intent for an order, and at 2 o'clock this afternoon, we were able to get the final draft, the legal language associated with that order. And one of the things that we want to do for the board and for the community is really try to rectify or consolidate, or reconcile, I should say, the differences between our recommendations and what has now been put into place as a law for the state of Indiana. And so what I'd like to happen now is I'd like to ask Chris Greisel, our city attorney, to come up and share with everyone the specific differences, because what the governor has passed into law is now the law. So that is the bare minimum, the standard for which we have to adhere to, and we really want to limit down our conversation today to those things that would go above and beyond what the governor's orders are. So with that, Chris, I'll turn it over to you.
Thanks, Mayor. Good afternoon, Board of Health. For the record, Chris Greisel. As the mayor mentioned, executive order hot off the press here at about 2 or 2:30. An executive order, remember, issued by the governor establishes the new baseline, right? So as a local health department, we're allowed to be more restrictive than the orders that have been issued by the state, but we can't be the least restrictive. So with the governor coming out on Wednesday, making the announcement, issuing the executive order today, that sets the new baseline across the state of Indiana. The executive order rescinded our stage 5 category. So if you recall, for the last few months, we've been on this Back on Track Indiana plan, going through the various stages of implementation. So on Wednesday, the governor announced that he was rescinding stage 5 of the executive order, and he established and implemented measures and restrictions based on a new county assessment. And the county-based assessment, this color-coded assessment for each category, is a blue, yellow, orange, and red category. And as of Wednesday, all but 4 or 5 counties in Indiana were in the orange or red category, which is the most severe or second to most severe category, based on the county status as community spread. And Hamilton County is currently in that orange category. So the executive order implemented measures and restrictions based upon these county assessments. They provided general requirements for all Hoosiers and individuals within the state. It reinstituted the governor's face mask order, provided general requirements for all Hoosier businesses and entities in Indiana, provided directives to restaurants, bars, taverns, gatherings or events, K-12 educational institutions, and provided special measures or restrictions for counties based on their color designation. So what I was going to do is walk through what those specific requirements were, because one of the things we noticed with the governor's executive order with respect to the categories, they really closely aligned with what Public Director Monica Heltz and Dr. Indy Lane came up and made recommendations for you on Tuesday. And so within those categories, with respect to social gatherings and events, A social gathering under the state's executive order, it's defined as a event, assembly, or convening that brings together multiple people individually or from separate households in a single location, whether held indoors or outdoors, in a private residence, commercial venue, or other public place at the same time and in a coordinated fashion, where a significant purpose is to interact with others, such as a wedding reception, funeral visitation, family reunion, party, barbecue, picnic, or club meeting. Under the governor's executive order, it is recommended that all social gatherings, be canceled or postponed. However, if they're going to continue, they're going to continue based upon your county's designation. So Hamilton County is currently in orange, and under the governor's executive order, counties designated as orange may have up to 50 individuals present, both inside or outside, for social gatherings. The most restrictive requirement, red, under the governor's executive order, allows up to 25 individuals to be present for those social gatherings. With respect to an event, the governor's executive order defines an event as an assembly or convening of multiple individuals from separate households in a single space, indoors or outdoors at the same time, but where the main purpose is not necessarily for individuals to interact with others outside of one's household, but to engage in or attend a business, commercial function, single event, or events of limited duration, such as conferences, conventions, sport or racing competitions, extracurricular school events, concerts, shows, fairs, festivals, carnivals, graduations, ceremonies, and a few others. Under the governor's directives, an event, again, falls under the same county directive. So an orange county is limited to events of 50 or fewer people. Red counties are limited to events of 25 or fewer people. And then if individual events want to exceed those categories, they have to seek permission and submit a plan to the health department at least 7 days in advance for the health department's review and approval. With respect to restaurants, the governor's executive order provides that all patrons must remain seated while consuming food and/or drink or when otherwise remaining on the premises. While capacity limits are no longer based on a percentage of overall occupancy, seating must be arranged and maintained so that individuals, households, or parties are spaced at least 6 feet apart from any other individual, household, or party. Finally, self-service beverages and food stations like buffets and bars are permitted but are not recommended unless a staff member serves the patrons. With respect to the category of extracurricular activities and recreational sports, the governor's executive order again breaks that down based upon your county designation. Within the orange category, which again Hamilton County currently is under, attendance at winter K-12 extracurricular and co-curricular activities, including IHSAA sports events, is limited to 25% capacity, and additional measures should be taken to ensure all non-family household groups are and remain socially distant. Community recreational sport leagues and tournaments may continue. However, attendance is limited to participants, required personnel, and parents and guardians for the minor participants only. So that would cover our Mud Sock youth athletic groups, the YMCA, et cetera. Counties that are designated as red, the attendance at indoor K-12 extracurricular activity and co-curricular activities, including IHSAA events, is limited to just the participants, support personnel, and parents, guardians, or siblings. With respect to community recreational sports and tournaments, the same guidelines are provided that only the participants, required personnel, and parents are allowed to attend. The governor also outlined enforcement procedures that I think are important just to go over, because I'm sure you've seen in the news over the last few days there's been some questions or challenges of authority with respect to enforcement. And he provides a directive to health and law enforcement officials across the state of Indiana, where the Indiana Department of Homeland Security, Alcohol and Tobacco Commission, local boards of health, and other state and local officials or law enforcement officers may take all available administrative and enforcement actions against businesses in accordance with the following directives. Number one, issue a verbal order to cease the unsafe practice so an owner has an opportunity to comply. Number two, if a business entity fails to comply with the verbal order, health department should issue an order to cease the unsafe practice. Number three, if a business entity continues operation in an unsafe manner, despite an order to cease and desist, the relevant official should issue an order to close the business entity. Number four, if an order to close a business entity is issued, the business shall be reported to the Secretary of State and relevant licensing boards and agencies. And then number five, if an order to close a business is issued, the matter should be considered for referral to the local prosecuting attorney. And right now, our communicable disease ordinances under our public health code that our city council has adopted contain similar language with respect to referring non-compliant individuals or businesses for enforcement authority. This executive order goes into effect this Sunday, November 15th, and it's going to last until December 12th, 2020, where we can expect the governor to probably issue subsequent guidance regarding those directives.
Thank you, Chris. So to summarize, regardless of the actions taken here today, what you listed out from the governor's orders will be the law of the state of Indiana as of Sunday going forward.
That's correct.
Okay. And I think it would be remiss if we didn't say, since our last conversation, we've also seen the state break records in the number of people infected with COVID. And so our work today on this board is to work with Dr. Lane and Monica and try to reconcile, if we so choose, between the governor's orders and any additional restrictions that we would want to see moving forward. And I think for the purposes of making this simple and constructive as we move forward, there's natural categories that these fall into. And at this time, maybe Monica or Dr. Lane, if you guys would want to go up to the podium, because I'm sure we'll have questions or conversations with you. I want to go through each one of these and offer for the board to ask any questions, have any comments. I think, and correct me if I'm wrong here, Monica, from the health department standpoint, the recommendations that you've provided, you have not provided any revisions to date. These are still the same recommendations that we shared on Tuesday. Is that correct?
That's correct.
Okay. So with that, I'm going to skip around on these on this graph if I could, because I know there's been a tremendous amount of traffic around extracurricular activities. We've heard from a number of residents, and just know that all of the written comments that were supplied to us or provided to us via the website have been shared with all of the board members prior to this meeting, so they've had an opportunity to review those. But I was, Kyle Holgren had reached out, a board member, and expressed some ideas or recommendations that he would like to share regarding extracurricular activities. So at this time, I'd like to have Kyle share his thoughts, and then we can have a discussion.
Thank you very much. And I think it really kind of plays out. One of the things we had the opportunity, we appreciate all the information and the data you provided on Tuesday, and that really gave us a good chance to go back and kind of digest and soak it in. And really with the governor's orders, I think one of the things that really kind of comes out here is one of the only things here, everything is looking fairly consistent across the board in terms of what the state's going to be enacting and locally, with really the one exception of the extracurricular and athletics. One of the things I think we look at the data from a public health standpoint, our goal should be certainly to either minimize, mitigate, or eliminate those high-risk pools and try and eliminate as much as possible. But one of the places where we've had data, and we even talked on Tuesday night, where our goal with this was to try and minimize time of impact, we really didn't have a lot of information around, was the actual activity itself, the extracurricular sports, where those students particularly, and not just sports, I mean drama, theater, mud sock, all of these things, didn't seem, it was continually in the lowest risk category. And so I would propose at least to reinvestigate this and take a look at if there was a way to reopen this issue and kind of talk more about the idea of a way to do extracurriculars or athletics, but in such a way whereas, similar to some of the other with approval and some guidelines, letting people know that this is very high stakes, right? It currently is a low risk category, but any kind of misadventures, inappropriate behavior, unmasking, any of those things that can raise it to a high risk category is absolutely also out of bounds. But I think there's a way that we might be able to identify and find a way for these students and people to get together and find ways to, and again, in the low risk capacity as the governor's outlined as well, orange or red, a way to make sure that even if it is just those student athletes, participants, thespians, musicians, however it is that they are able to get these things together, if there's a way we might be able to do this and maintain as low risk as possible and kind of investigate an opportunity to kind of fall in line with some of those recommendations there. So I think the evidence points to potentially that being supported and making sure that if we, as long as we maintain that low risk, that might be a good option moving forward as well to consider.
I think one of the genuine concerns I have is on the order of 25% capacity at a sporting event. If our gymnasiums can hold 6,000 people, still allowing 25% of the crowd to show up and congregate in those facilities seems like an undue risk, given everything else that we're trying to put in place. And under the current orange category, for extracurricular activities, it would limit high school capacity to 25%. So that, I understand the desire to have kids be in extracurricular activities, and in those controlled environments, I could see value in that. I do worry about falling in line with because we're in orange right now, and you would, under Indiana law, you would be able to have up to 25% of the gymnasium could be filled with people. And so that part, I guess, and I'm correct on that, am I not, Chris, on that provision? So that's my only counter to your statement there, and I guess Monica would look to get your thoughts or Dr. Lane's thoughts on that.
Yeah, I think to categorize some of the sports activity as low risk is a little not quite right. The governor early on in the phased reopening had some specific categories for sports that were higher risk and sports that were lower risk. As it's specific to sports, we know that there have been outbreaks in choirs. We know that band would certainly make sense as a potential spreader. Theater, they're projecting voices loudly. So these are all things that contribute to spread and to risk. So I just want to make sure to clarify that. Although we don't have a lot of local data that suggests that our athletics and band and choir programs have put the children at risk, they do have some pretty strong mitigation measures in place. I think that there is certainly risk involved in those activities. And the reason for our recommendation initially, aside from just the risks involved in all of that, is primarily because the situation is so serious at this point. With the number of cases, the hospital is going to diversion and potentially overflow very soon, that we really need to think about ways that we can restrict as many activities as we can that are unnecessary. So how the community and the board wants to recommend prioritizing those, we're open to listening to your thoughts on that, but really the situation is quite dire at this point. And so we're in a stage where we really need to think about what are the essential activities for us and what do we want to do about those.
Chris, just a clarification on the governor's order, does it require extracurricular activities to provide a plan to the health department for any type of mitigation measures? So is there any direct oversight for each specific extracurricular activity?
It does not. It just sets for orange categories, it sets the capacity limitation to 25 members in attendance. And then for the red categories, sets it to just limiting to parents, support staff, and players.
Other questions or comments from the board?
And then the additional, I'm sorry to interrupt, Mayor, the additional requirement is that in the red category, there's a redo of the declaration that all non-competing and non-performing participants, support personnel, and attendees are required to wear face masks at all times.
So Kyle, is there a particular motion you would provide in regard to this?
No, again, the recommendation was, and again, I just want to open up for discussion, so I do appreciate the additional data as well. And it is important. It certainly is not lost on, I think, anyone in this room that school was not open today because of a lack of staff. And that our biggest regret would be if we said that about hospitals in the near future. And I know that there's folks in here that are getting close to experiencing that as well. And that certainly is not my intention whatsoever. It was merely the idea we talk about the data and we mentioned there was a bit of a lack of it. If there was a chance to take a look at and see if there was a way to collect that data while looking at some of these selectively identified activities or things that are going on, if we could use that extension to take a look at that and collect some data, find out, are we actually doing more harm than good? And these are things that are very quickly, again, if that risk elevates, then that's something that should be put on notice very quickly, that that's no longer permissible activity. So again, I just was very grateful just to continue the discussion and look at some of
Yeah.
the data, and I appreciate the new
My,
information.
my thought here is that, to your point, Kyle, there's an opportunity to create a controlled environment where these kids can continue their extracurricular activities. My concern would be on the congregation of spectators, things of that nature that are currently under the orange standard. So
I
my
think some of
preference
the-
would be
yeah.
to allow some sort of extracurricular activities, but not under the orange standards by the governor's law, but instead say only a guardian or parent could be there to watch the sport, even though technically under Indiana law, we're under orange. I think that would be viewed as a red category, because it's also under the, that category, rec sports are already required to only have a parent,
That's
I believe.
correct.
So it seemed like you could make it consistent. I don't know what the board thinks of that.
I'm just, yeah, I mean, I understand what you're saying, and I understand where Monica and Elaine's coming from. I guess it's a balancing act, but at the same time, when you're seeing numbers spiking up, my concern would be, try to suppress this. My question regarding the state, it sounded like there's some punitive action if you're a restaurant. Is that correct? If you are found guilty of certain measures, or?
I think what they're trying to address is non-compliant businesses or entities that are not enforcing the mask mandates that are being provided in the executive order. So one of the different regulations, and I'm glad you brought this up, that is under the executive order is that all businesses in the state now have to post signs that say masks have to be required before you come in, and businesses are supposed to refuse to allow people to enter into their business or their restaurant if patrons aren't wearing masks, if visitors aren't wearing masks. So I think they're trying to set up a support mechanism to help establish that.
And the follow-up question would be, with the house gatherings, those are recommendations versus the law. Would that be safe to say?
Yeah, although under the governor's executive order, his social gatherings does include indoor private gatherings. I don't think it's his intent to regulate your private home. I think he's providing recommendations of what you should and should not do.
Okay. And I think that would be a message to the community. As just, I think some people get caught up in this. We're becoming some kind of a governing state where we're going to have patrol people knocking on your door Thanksgiving Day to see how many people are inside your house. And that is not the case, right?
No.
That is not the case.
It is a recommendation to try to help suppress this
Absolutely.
pandemic. And if you can do only just your household members, that's awesome. If you can go to 10 people, that's great. If you go to 15 people, that's on you.
Yeah, I think the intent of the executive order and then any public health order we've ever issued is to regulate the commerce that we can affect, right? It's business, it's restaurants, it's not individual households. That's where, to your point, our messaging has recommended that people take individual steps to voluntarily do these things.
I think to keep this on course and get through this document, as we look at extracurricular activities first, and we're going to talk about social gatherings, special events, restaurants, where we deviate from the governor's. I guess I would put a motion in place or request, entertain a motion to allow for extracurricular activities if a plan is provided to the health department for review and approval, and that we follow the governor's order of red, which means only a parent or guardian can be in attendance. And I know that our county is not technically in red, but I think as Monica has said and Dr. Lane has said, the severity of the numbers are such that we need to take extra precautions here. And I think also what is good, as Kyle mentioned, the ability for us to track the data and be on top of this so that if at some point those activities become higher risk or we start to see additional spread, then we're going to have to revisit this conversation. But I would make a motion to follow that course. Is there a second?
I second that.
Second. Is there any additional discussion or conversation on the issue or on the matter? Seeing none, is there a motion to approve? Say aye.
Motion to approve.
Any nay? Okay. Unanimous. All right. Thank you. Let's move on to the next item here. So we've talked about extracurricular activities. Let's talk about social gatherings next. And Monica, perhaps you can help, or Chris, because this gets very confusing for the public. I think the difference between social gatherings and special events under the governor's order and then also under ours. So maybe we could just reiterate again what the difference between those two are and how we would go about addressing those.
Sure. So again, from the executive order that was issued today, the definition of a social gathering is an event, assembly, or convening that brings together multiple people individually or from separate households in a single location, whether held indoors or outdoors, in a private residence, commercial venue, or other public place at the same time and in a coordinated fashion, where a significant purpose is to interact with others, such as a wedding reception, funeral visitation, family reunion, party, barbecue, picnic, or club meeting. It's recommended under the governor's executive orders that social gatherings be canceled or postponed. However, if they're going to continue, the host of a social gathering must ensure that social distancing requirements can be achieved and maintained. Face coverings are worn and other sanitation measures are implemented at the site where the gathering occurs. Under the counties designated in orange, social gatherings can have up to 50 individuals. Counties designated as red may have up to 25 individuals present. And then for any social gathering where the number of attendees exceeds those limitations set by the state directive, has to have approval from the local health department. An event is defined as an assembly or convening of multiple individuals from separate households in a single space, indoors or outdoors, at the same time, but where the main purpose is not necessarily for individuals to interact with others outside of one's household, but to engage in or attend a business or commercial function, single event, events of limited duration such as conferences, conventions, sport or racing competitions, concerts, shows, fairs, festivals, graduation ceremonies, extracurricular school events, fundraisers, and other entertainment events. Under the state's directives, counties in orange may have up to 50 individuals present at an event, and counties designated as red may have up to 25 individuals present for an event.
And can I jump in for a
Yeah,
second?
go ahead, Monica.
Chris, I thought I heard on the press conference, and I haven't had a chance to really thoroughly read the executive orders, that they actually don't recommend any of those events in the red category. Is that correct?
That is correct.
Okay.
And then again, one of the items that the governor touched upon is that religious services are not included within those social gathering restrictions. There is a special section designated to religious services in the executive order where the governor is encouraging religious institutions to switch to virtual services if possible. If live or in-person religious services, including wedding ceremonies and funeral services, continue, they are not subject to those social gathering limitations. However, they still have to maintain social distancing, face mask, and sanitation throughout.
One thing that might be helpful, Monica, around this orange-red conversation for our county, just a refresher for those watching and those here today and for the board, the two measurements that they use for determining whether you're in orange or red, and then where we stand currently in terms of our numbers, because I think I saw today that one of those metrics, I believe, we're exceeding now in Hamilton County. So can you just talk about where we're at in the continuum of orange and red?
Yeah, that's a good point. Thank you. So our metrics and the state's metrics are a little bit different. The state uses a 15% cutoff for the percent positivity using an all-test measure before they move into the red category for that measure. I'm not actually sure what their percent positivity rate is at the county level using that measure today. Yesterday it was 10.2%, I believe. We use an individuals tested percent positivity rate. We feel it to be more accurate as far as reflecting what's truly going on. Our percent positivity rate today in the county is using that measure, which is again the one that we use on our community dashboard, is 17.3%. So by that measure, it would be red in the county, except for that they're not using that measure. So. As far as our case incidence rate, our red cutoff is at 25 cases per day average over 14 days. We are now at 45.37 daily case incidence rate. We had nearly 100 cases a couple of days ago. So it's a pretty steep increase on that. I'm not sure what the county's case incidence rate is today. The state uses a slightly different calculation. I think they count maybe all the cases in 14 days or something like that.
I believe it's weekly.
Weekly, okay. I can tell you that we had 377 new cases in the past 14 days. So some of the states are using a 14-day calculation. Some are using a weekly calculation. So we could, I don't know, I would roughly guess about 200 in that case. That's done on a per 100,000 of the population rate calculation so that you can kind of average it out depending on what population size you have. Our population is really close to 100,000, so it makes it pretty easy to estimate those. So again, I would estimate that at about 200, which I think is right around the state's cutoff for that category, if I'm not mistaken. Again, I don't have it in front of me.
So the difference here on social gatherings, the regulation, what we proposed was 10 people inside, 25 outside, and the governor's recommendation is 50, and he makes no distinction between inside or outside. So the governor's is 50 in orange and 25 in red. So if we were to follow the governor's rule, it would allow for 50 people to meet or gather in a social gathering, and under our proposal, it would be 10 people inside and 25 people outside without plan approval, I believe, by the health department. Is there any questions or thoughts, recommendations regarding whether we stay consistent with the recommendations provided by Dr. Lane and Monica, or whether we go along with the governor's order or some variation of it?
I really appreciate the distinction between inside and outside, which is different than the governor's orders. Monica, can you speak to the increased risk that has occurred because of inside activities and family gatherings and social gatherings?
Well, I think we're all pretty familiar with the messaging that's been going out all year, just about the decreased risk of being outside. The main reason for that is the increased ventilation from being outdoors, right? So that's the real purpose in having that different risk. Anytime you're in a small closed space with a virus like this, you're going to have a higher risk of transmission. So that was the rationale that we used for taking that size limit down. The other thing is that there's an interesting calculator that we've been looking at, developed by the Georgia, school in Georgia, I'm sorry, I can't remember the name, where you can plug in your gathering size and look on the map of the United States and find what's the risk that somebody in your gathering based on that size and where you live or where the gathering is going to have COVID. And right now, based on that calculator, if you have a gathering size of 15 people, you have over 50% chance that somebody in that gathering is going to be carrying COVID, whether symptomatically or asymptomatically.
Thank you.
Any additional questions or thoughts, comments in regard to whether we stay consistent with the Department of Health's recommendations or the governor's?
Do they get into any detail about what counts as outside? I've seen some interesting assertions as to what counts as an outside structure in the last several months.
So that's a good question. I don't know that we had gotten in that detail in the draft public health orders that we had written up. Obviously there are some less useful outside versions of structures, and the more enclosed the structures are, you're basically making it inside, and if you're not careful, you can make it even worse than being inside because you don't have any ventilatory exchange. Like if you're in one of those igloo dome things and you're sealed in there, you're not going to have any ventilation. So,
can you speak a little bit, Monica, to the challenges for our contact tracers when we have a group the size of 50 people inside, and 2 people end up having COVID in that social gathering, you know, the workload associated with that and what kind of strain that puts on your guys' ability to track these down and isolate to the best of our ability.
Sure, yeah, obviously, contact tracing is difficult in the best of circumstances, and when you get into a gathering size that's very large, you know, sometimes you have to make assumptions depending on the kind of event, whether, you know, was everybody hugging and kissing, because that automatically defines you as a close contact, you know, or were you within 6 feet of a person for a sum total of 15 minutes during that period? Well, when you're bobbing in and out with people, if you're like at a wedding reception or something like that, and you're, you know, having all of these small encounters, do you have any idea even if it all totaled up to 15 minutes with one person? And then are you going to tell our contact tracers that you did, or are you just going to think about the people that you sat near or that you danced with or whatever? So it becomes very, very difficult to even have any kind of accurate accountability for events of that size.
Great. Any additional questions or comments? Seeing none, I guess I would assume that since there's no suggestions to deviate from the health department's recommendations, is there a motion to approve the health department's recommendations of no greater than 10 people in a social gathering inside and 25 people in a social gathering outside? Is there a motion for that?
Motion.
Motion by the chief. Is there a second? Second. All those in favor, please say aye.
Aye.
Motion carries. Let's move on to special events, if we could. The only difference here, and help me understand, Chris or Monica, the only difference here is that we say in the initial board recommendation is any special event has to get a plan approval by the health department. And the governor's order is that if you had a special event in orange, which would be you could have 50 people or under and you wouldn't have to get a review by the health department, or 25 and under, you would have to get a review by the health department under red. That's really the only thing we're really talking about is the threshold for the health department's plan review. Is that fair?
That's fair.
Okay. So this is just really a question of, from my perspective, workload for you. And because obviously, if we were to bump that up, you have less that you have to review. But I have a hard time in our community thinking of a number of special events that would occur that are 12 people. So I guess that's the question I have is, what is the true impact of falling in line with the governor's mandate? How many events, as we think about our community, would fall into that category of?
Are you saying between 10 and 25?
Under 50 people? Keep in mind, social gatherings are different than special events by definition. So I'm asking, from your perspective, how many special events that are under 50 people that if we didn't follow the governor's guidelines but followed yours, that you'd have to review all plan
Oh, I
review?
don't want to review all of those, no.
Yeah. So
I don't know how many there are, but I imagine it would get really messy.
yeah. So I guess my question is, in that case, are we better off just following the governor's guidelines at 50? You have to turn all those into the health department and fall into to be consistent with the governor's orders.
So just so that I'm clear, the special events would be in a different category of less than 50 versus the 10 versus 25 social gatherings.
Yeah, by the definition of
restrictions
social gatherings versus
based
special
on
events.
the definitions. Okay.
Chris, is that tracking for you?
So you might want to repeat that. I was looking through something.
Question is,
Yeah.
if social gatherings are regulated under that definition, and we go down to special events, under the governor's definition of special events, how many special events are we actually going to have under 50? And is that something that Monica's staff really wants to do plan review or has the capability of doing plan review? Or should we just fall in alignment with the governors in that any special event over 50 has to get a plan review by the health department? Does that make sense?
It does,
If-
yes. I think by the way that we define the special event, it does.
If you're recommending something along those lines, I would prefer that the cutoff be 25, just so that there's no middle period that people are confused about.
Okay.
So using the governor's red category.
So it'd be consistent with what we were talking about with the attendance of a recreational, that makes sense.
Yeah, stay in the red
Yeah,
Because if you're going to be in the red in the other areas, why you,
be consistent.
But I would also reiterate and maybe make sure that the language in there said that they are not recommended in that category, as the governor said, even though it's our category of red, not their category of red.
So is there a motion to adopt the red maximum capacity, or minimum capacity of, maximum capacity of 25 for a special event without a plan review approval by our health department?
I motion.
Motion, is there a second?
second.
Second, all in favor, please say aye.
Aye.
Motion carries. We'll move on to restaurants now, and I think, Chris, perhaps you could help further break down each one of these for our discussions as to what is differentiated from the governor's order, because I think this one has the most variables, so maybe you could just talk through each one of these for the board.
Sure, so I think maybe it's more helpful to start off with what the governor's executive order said today. So again, through the executive order, applicable to all restaurants, bars, taverns, nightclubs, or other establishments providing in-person food or drink service, must follow the following directives. Number one, all patrons must remain seated while consuming food or drink, or when otherwise remaining on the premises. Number two, while capacity limits are no longer based on a percentage of overall occupancy, seating must be arranged and maintained so that individuals, households, or parties are spaced at least 6 feet apart from any other individual, household, or party. And then self-service beverage and food stations are permitted but not recommended unless a staff member serves those patrons. So I think all three of those items were originally addressed and recommended by the health department on Tuesday. The additional items not in the governor's executive order that were included in the original recommendation included party sizes being limited to 8 people or less. No bar top seating is permitted, so no bar service. Tables within the bar area may be open for table service, but nobody's sitting at bars. And then finally, there was a limitation on the lobby area, a recommendation that no more than 2 persons may wait in the lobby for a table unless social distancing can be accommodated. And I will say that also in the governor's executive orders, there's a lot of general business requirements about making sure that social distancing requirements like placing stickers and other items are made available within your entity.
So does anyone have any concerns, questions, comments about the additional mitigation measures that the Department of Health has recommended that are beyond what the governor's order has required? And those would be the ones in red on the chart. Anything?
I'm just curious about the, since we did for social gathering, so if going out to dinner would be a social gathering, and we have that as 10 in the initial recommendation and 8 in restaurants, is that considered a difference because of the venue, or is it just kind of something we should take a look at? I'm just curious, actually.
It's not a difference in the case of the venue, and if you were going to change one thing, I would quite frankly change the social gathering down to 8, and that would probably be less popular.
and hence why, exactly, just making sure that we're easy.
From a just an executive order perspective, I can tell you that they separate the two in the conversations.
Okay.
So they do, sometimes an event can be held at a restaurant, right? Where you have like a business dinner there. I think those are addressed, but general going to a restaurant meeting have been separated from social gatherings, just from a legal perspective.
Got it. Thank you.
Any other questions or concerns, comments before we consider these additional mitigation measures recommended by the health department? Seeing none, I'll entertain, is there a motion to approve the additional measures as outlined in the red bold letters here in our board recommendations?
Motion.
Motion, is there a second?
Second.
Second, all those in favor, please say aye.
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 Motion carries. And then I think the only other part on this graph that really, there was really no actionable item by us is in general businesses. The governor did require that there's signs posted that all visitors must wear masks. And I do want to allow for some time here, Monica. Maybe you can talk a little bit about your department's plan for enforcement. because I do think we're in a different category now, as the doctor said here a second ago. The seriousness of this situation and just what our plans are from an enforcement standpoint moving forward around some of these issues.
Yeah, so we're going to be heavily reliant on the public to report any violations that they see, as they have been doing, and we will also be we're looking to consolidate some of the links that we have on our website, because we have one specific to mask mandate complaints right now, and then we have some other general complaints. So we're looking to try to streamline that process, so they all go to one space, and then they'll be assigned to our inspectors to follow up on. They're shifting their hours so that they can cover some of the other times that aren't traditionally in the normal 8 to 5 business hours. So when we're thinking about bars and restaurants that operate well beyond 5 o'clock, when we think there may be more likely to be some trouble spots, and they will be following up on those immediately, same day. And then, of course, we'll be following the governor's steps in regards to enforcement. As with all things health department, our first approach is always to educate and assume that they want to do the right thing, and give them that particular guidance, and then we move from there.
Well, and I appreciate your time yesterday. We spoke to about 170 businesses and then another 75 restaurants in the afternoon, and I believe that all of our businesses want to do the right thing, and we want to be there to help them and educate and guide in any way that we can. I guess one question, Chris, as we wrap up here, in regards to the ability to draft the actual order, ultimately Dr. Lane is the ultimate authority here, and signing that has the ability to execute this order. When do you think you would have the document available for, an executed document available for businesses, residents to be able to review? And then I think as a board, we should recommend a date of actual implementation based on that.
I think certainly I could have the document ready by Monday morning for everybody to review in the general public. I would recommend, so the governor's executive order is going into effect on Sunday. I would recommend probably providing a few additional days, particularly as we have some additional requirements that are going to be placed upon our restaurant community, to give them notice of maybe having an effective date of Wednesday of next week, just to give them a few additional days to understand what we're requiring of them. And then the final thing I would ask is probably for a sunset clause, some date certain that we could revisit this. As we know, this pandemic's ever changing. I think there's some sense in reconvening at the end of this month to figure out whether we want to keep some of these recommendations, change them, add to them. However, so I would recommend that we put a end date of November 31st, unless otherwise extended
That date
by a
doesn't
subsequent
exist.
order.
That date doesn't exist.
Well, there you go. How about November 30th?
November 30th, there you go. Good call. So we'll go ahead and include that, and Dr. Lane, if you're fine with it, then I guess at this point I'd like to ask Dr. Lane if you have any thoughts or closing comments. I know you've been busy at work trying to lead Community Health Network through these challenging times, but any perspective you could provide to our community just in regard to the work that Monica and her team's done, or your perspective moving forward?
Sure. I just wanted to ask really quickly, though, about that date. I am a little concerned, as most people are, about the Thanksgiving holiday. And do you think that it makes more sense to revisit some of these things when we've had that 2-week lag after the holiday? I'm just asking the question. I think we may be in a better position to understand what things look like in our community 2 weeks after, kids come home from college and people have hopefully not gathered in their homes, but in the event that they do, we might be able to better navigate the orders. So just the thought, again.
It makes sense, and ultimately, we're deferential to you in that regarding, because,
So that would just be my recommendation, maybe the first week of December.
Sure.
Again, that would give us some more perspective. And, I'd just like to thank the board, definitely thank Monica and the mayor, and I think that what we're really trying to do is encourage people to understand that everything that we do is associated with risk with this virus. And we have to prioritize the things that we find most important for most people. That is work and school, healthcare, and getting food. And we want to make sure that we support our local businesses and encourage them to be creative about ways of providing no contact or low contact services. But I just want to strongly encourage our community to recognize that this is something. We are seeing our numbers in the hospital double each week. We are looking at diversions and, not being able to take care of people. And we want to keep our, hospitals open. We want to keep our schools open and keep our businesses open. But it really, really depends on everybody wearing their mask, sanitizing their hands, not having social gatherings in their home or at work when you're in your break rooms. Everybody needs to take responsibility so that we can try to function in a safe and normal capacity. But we really have to prioritize our activities.
Thank you, Dr. Lane. And I thank you to the medical professionals that are sitting up here at this board, and Dr. Lane, for you and your time. I know you're all very busy just dealing with the patients that need your help, and for the fact that you take time out of your busy schedules to also be a part of this community conversation. Very appreciative. And Monica, you and your team have just done an amazing job. I think today we crossed the 20,000 threshold for the number of people that have sought out and received a free COVID-19 test from the city of Fishers. It's 20,000 individuals that received a test in our community. That's incredible. And today, because of your team, we announced an increased capacity of another 100 a day that we'll be able to work through. And then we're also working with our schools, and hopefully we'll have some announcements where we, yet again, will try to help our schools stay open in a safe and effective manner here next week. So I can't thank you enough. It's been countless hours, and frankly, the berating that you get from the community at times, because we're telling them things that they don't want to necessarily hear. And you've been steadfast, so thank you so much for all of your work going forward. I know you'll do the same. So with that, is there a motion to adjourn the meeting?
I just wanted to,
Yeah.
I wanted to also, you have a thankless job. And I see that there's members of the community out here, and when you show up here, it shows that you're passionate about this. And what I see is from the comments, there's two sides, and it's very split. It's either open up everything or shut everything down. And you can go with shut everything down, or you can go the Sweden approach. But I just want to remind the community and the people here that initially the whole premise behind flattening the curve was to try to help not snuff out this disease and make it go away. It was to not overwhelm the hospital system. And we're seeing that again. And for anyone who thinks, well, there's a mortality rate that's not that high, that's great. But the people that are still sick are still coming to the emergency department, and they're still being admitted. And when you end up overwhelming the hospital system, then when your kid or loved one has another illness that has nothing related with COVID, but they can't be admitted because of this, then we failed. So you have a thankless job, but I want to thank you for what you're doing. And I want to thank the members of the community that it shows that you're passionate about this. Unfortunately, there's no right answer. We're not going to make everyone happy. And we have to accept that this is part of our lives right now.
Well, I think we've done that, sir, and so I'll ask and entertain for a motion to adjourn. Is there a motion?
Motion.
Is there a second?
Second.
All those in favor, please say aye.
Aye.
Meeting adjourned.